Hello everyone, I'm Mr. Hernandez today with NCLEX.Solved, and today I'm going to be discussing oncotic pressure. So, oncotic pressure, in essence, is the story of how albumin, which is a protein by the way, how it dictates water composition throughout the body. It dictates where fluid should be at. There's three main components, or compartments, excuse me, of where the fluid should stay. A certain percentage will be inside the cells, or the intracellular compartments. A certain percentage of fluid will always be in the extracellular compartment, or the intravascular space, or outside the cells. And then a certain percentage of fluids will always be inside the interstitial compartments, or within the tissues. But if your albumin is in normal levels in the body, the percentage of fluid that's supposed to be in each of these compartments will be normal, and hence you will not be walking around with edema or anasarca. But there are a few conditions where the body either loses proteins or it cannot manufacture them. An example of a few of those conditions would be glomerular nephritis. Another condition that affects the kidneys would be nephrotic syndrome. Both of these two conditions, folks, changes the permeability of the glomeruli. So what ends up happening is we develop proteinuria. You'll have proteins inside the urine, and essentially if they're in the urine, they're not in the body, you're losing proteins, and that in itself, folks, leads to anasarca, because the protein is no longer there to regulate or dictate where the fluid's supposed to be distributed. That's a little difficult to memorize sometimes. So what I've done is I came up with a way to make it a little bit easier. So everybody knows what a pimp is, correct? A pimp has a pretty decent relationship with a harlot. A harlot is a prostitute. The reason why I like to use this analogy is A, it's funny, okay, and secondly, is because it's really the relationship between proteins and the fluid inside the body. A pimp tells a harlot where to go. You could go down Gary Avenue, you could go down Park Avenue, but you cannot go down 12th Street. That's just a little example of what happens. So the proteins in the body, in particular albumin, has a relationship with H2O. That's where the P and the H's come in. Not to be confused with potential hydrogen. I'm not talking about that right now. So the pimp tells a harlot where to go, but what happens when the pimp gets arrested or shot? The harlot is free, and now she can go anywhere she pleases. Or in essence, that's the concept that I want to carry out for you guys. Well, in the body, you have proteins, but if you have glomerular nephritis or nephrotic syndrome, the glomeruli loses its semi-permeability and it loses proteins in the urine. Concept is simple. The proteins are gone, and now the water is distributed where it's not supposed to be. Hence, you develop anasarca. This concept, folks, contributes to, let's say, ascites in liver failure. It contributes to any particular position or condition, excuse me, where the fluid leaves its corresponding spaces into a compartment where it's not supposed to be, and then you walk around with anasarca or some type of generalized edema, or maybe periorbital edema. And that's essentially the relationship between the proteins and the water, and that in itself, guys, is